coming out today. Today we're going to talk about school success after diagnosis. Just hearing a couple things earlier, I think this is a crucial topic for parents who are concerned with their kids no matter what age, all the way up through college and after. Just to tell you a little bit about myself, my role is I act like a liaison for parents who are dealing with supports for their kids at school when health concerns impact their child's learning at school. So I collaborate with patients, parents, school administration, and the medical team to make sure that we get everything in place for these kids. I work with our medical team to help identify supports that are needed, and I also make recommendations and requests for school. And I also attend school meetings, even at the college level. I think it's important to also talk about what the parent and guardian role is in making sure that your child is successful at school. A positive relationship with school is critical when a child has a disability or a health condition. I think a collaborative team approach is key. Parent communication and involvement does truly affect your child's cognitive, emotional, and behavioral performance. Working with someone like myself, a hospital school coordinator, the medical team, and the school to advocate for the needs of your student is very key. So today we're going to talk about, and you might be familiar with this, but just various laws that impact our children with health impairments after diagnosis. So there are three. The ADA, which is sorry, I just lost my train of thought. The Americans with Disability Act, the IDEA, which is the Individuals with Disabilities in Education Act, and then there's the Section 504 of the Rehabilitation Act of 1973, which refers to our 504 plans. Disability, defined in the IDEA, requires the student to have a qualifying disability who experiences a lack of academic progress requiring specialized instruction or services. And this is where our special education is represented, or SPED. When a child is identified in the school setting who may benefit from and qualifies for an IEP, the law dictates a very specific process with time frames for completion. Not all children with Chiari qualify for an IEP. So today I'm going to focus more on what the 504 plan would look like. Before I do, I just want to talk about disabilities and what those are listed under IDEA, as well as Section 504. And the one that I have highlighted is other health impairments. And this category is where most of our kids who are newly diagnosed, this is the category they fall under, health impairment. This is a nice breakdown between Section 504, which is a 504 plan, and an IEP. So I'm just going to go over this really quickly to kind of just give you a better idea. The description for a 504 plan is kind of like a blueprint or a plan of how a child will have access to learning in their school environment. The best way I can describe this as is in-classroom accommodations or modifications directly in their classroom setting. They're not pulled out for any special services. Whereas an IEP is special education and related services. This is where those are addressed. So whether or not your child is pulled out, they still are receiving specialized services under the IEP. I already talked about the law, which governs the 504 plan and an IEP. Requirements for eligibility. For Section 504, the disability would have to interfere with the student's ability to learn effectively in their general education classroom. Whereas an IEP, which meets criteria under the IDEA, shows that your child, their impairment significantly impacts their educational performance and does require specialized services. Both of them can include accommodations, modifications, and then IEP, more specialized services with direct service minutes included in that. What's nice about the 504 plan is there are no age limits. Under the ADA, with a health impairment, you can have accommodations in place all the way through college into your work environment. An IEP is age 3 to 21 years of age, and it's actually in Illinois. Once you hit your 22nd birthday, your IEP has been dissolved. That's why a lot of times in high school, when kids are transitioning from senior year into college and have an IEP, I always recommend the families to possibly drop down to a 504 plan if their needs aren't significant enough that they can still be successful with basic accommodations within a 504 plan. That's what we'll carry with them into college. Let's see here. Both are living documents. I would say the 504 plan is a little bit more fluid and easy to update, correct, omit things out of, whereas an IEP, it's a formalized process and it does take time. Whether you need to make changes or you're just meeting annually, it is a lot more invasive of a process. The time for Section 504 varies by state, usually reviewed every year with a reevaluation to determine continued supports every 3 years. But again, it's a fluid document, so you can add or review at any time. An IEP must be reviewed at least once per year and then reevaluated. Each child needs to be reevaluated every 3 years to determine if there's continued eligibility. So what is a 504 plan? Most children diagnosed with Chiari will have this. A 504 plan is a legal document for students with disabilities who do not require specialized academic instruction. Section 504 of the Rehabilitation Act expands the definition of a disability into the following broad and simple definition. A disability is a mental or physical impairment, there's that key word again, impairment, that substantially limits one or major life activities. Children with Chiari may have specific accommodations dependent upon their personal needs, their extent of the disability, and the disability's effects on their school environment. Now please note that a child with Chiari who is asymptomatic and has no restrictions may not even have a 504 in place at school, so no accommodations. With a 504, some samples of accommodations are modified or excused PE, and I think someone mentioned earlier that your child may sit out of PE here or there, depending on if they're having headaches or different effects, side effects. A hall pass for the nurse and washroom. This is especially key in high school because you walk out of a classroom and if you don't have a pass on you, there are deans or other teachers hounding you as to why are you in the hallway. So this is key to have just in case you need to get up and leave to go to the nurse or a washroom break. Second set of books to keep at home. We all know how heavy those books can be and the backpack can get very heavy. Extended time for classwork, homework, quizzes, and tests. This is key. We have no idea. Your child may go off to school one morning feeling great, and then by mid-morning they have a severe headache and they're sitting down to take a math test and can't get through that test. So this one is crucial. A modified workload, emphasizing quality over quantity. Now I say that because a lot of times when I talk with families of kids who are in the hospital, they might be out 2 weeks in the hospital and have had no energy or not feeling well enough to do any type of work. At the high school level, 2 weeks seems like it's just a crazy amount of time to try and make up all that work. So that's kind of where this comes in, quality over quantity, making sure that the student understands the concepts rather than giving them 10 math worksheets, maybe only give them 2 or 3, depending on it, once they grasp that concept. And I do say that primarily that is used when they are absent, not directly when they're in the classroom. Preferential seating is another one. Not only near the teacher, but maybe near the door. If your kid is one that tends to get up and goes to the nurse or needs washroom breaks frequently, that is also key for them to be maybe more near the door. And snack or water as needed. A lot of times kids are on different medications that requires they have a snack 3 to 4 times a day. Again, at the high school level, kids aren't required to eat in classes except at lunchtime. So sometimes having this in place is also beneficial. So, how do I know which plan is appropriate? This can definitely be confusing for parents to address when confronted with their child's Chiari diagnosis. The plan program that your child may qualify for is determined by taking a look at your child's academic progress or lack of progress. Again, a collaborative team approach is needed here. You sit down with school administration, your student's classroom teacher, special service providers, the school nurse, and if you have a hospital school coordinator, that would also be key. So now I'm going to talk about 2 different scenarios and how this plays into my role and how I help families. Again, this is not Chiari diagnosis here, but just 2 separate scenarios that kind of give you a better idea of sometimes the school side of it and how there's a lack of education on their part as far as the medical piece of it. So Kelly is a 4th grade student at her local public elementary school. Her teacher notices that Kelly has trouble concentrating during class lessons, and it takes Kelly significantly longer than most students to complete in-class assignments. While the teacher acknowledges that it's very difficult for Kelly to stay seated and on task, she doesn't think Kelly needs special education services because she is earning B's and C's. What should the teacher do? Before I get started on what the teacher should do, I think this is quite common across the board. When kids are doing okay academically, teachers are not as worried even if they start to see red flags come up in the classroom, just because it's not affecting their academic performance. But Kelly's teacher should inform administration or Kelly's parents that the student needs an evaluation for proper determination whether Kelly needs an IEP or just a 504 plan. Even if her grades are good, this does not necessarily indicate that she does not have a disability or needs supports in place. Even if Kelly does not qualify for an IEP, special education services, she can definitely be serviced under a 504 plan with direct classroom accommodations. And some of those might be just needing extra time when she's in class for classwork, homework, tests, quizzes. And another crucial one is having check-ins with the teacher or a teacher's aide in the classroom to help her stay on task. So the reason that I kind of push here for the 504 plan is because if Kelly has a sub one day, or say the family moves away to another community, if this isn't documented for her, she's not going to continue to always get those supports in place at school. Scenario 2. Maya is a good student who has an A in reading, A in math, and a B in each of her other classes. She maintains these grades even though she has been absent several times since the beginning of the school year for a gastrointestinal disorder. In addition, she often has to leave school early because of vomiting. Maya's mom took her to the doctor, and the following week, Maya's mom presented Maya's teacher with a medical report indicating that Maya suffers from GERD. Maya's mom then asked the teacher if the school would evaluate Maya to see if she is eligible for Section 504 services. The teacher told mom not to worry, noting that an evaluation is not necessary at this time because Maya continues to do well in all her classes. The teacher then promised to let Maya's mother know immediately if Maya's grades begin to decline. Should this teacher have responded in this manner? Absolutely not. And you'll find that a lot of teachers will say, we'll support your child in class as needed, but we don't need to create a 504 plan for your child. Again, as the last scenario I stated, it's always important and imperative to have that plan in place to protect your child. So, number 1, newly diagnosed with any type of chronic illness warrants for a 504 plan in school. Parents should request for this documentation to become permanent record for their child's needs. Intermittent homebound can also be requested through the physician who believes your child could possibly miss 10 days or more throughout the entire school year due to their diagnosis. So there's 2 different forms of homebound: intermittent homebound, which is what I just explained, and then full homebound. And that's for more of the students who can't attend school for longer periods of time, then they are put on full homebound. And homebound, basically what that is, it's just tutoring in home through the school district, which is the law. 5 hours per week is the maximum. So kids, usually teachers will come for 1 hour per day, depending on what the child can withstand for that week. Maya's illness does impact her learning, and accommodations should be set up. So again, she has GERD. There are instances of her vomiting. Whether she's in school or not, she is still trying to maintain sitting in a classroom every day, maybe not feeling good, maybe having to go to the nurse, possibly during a class test or even during class discussion or instruction, and therefore she's missing class time. And again, accommodations built in will help her to remain successful. Maya would keep this plan all the way through high school and into college, with adjustments made to accommodations as needed. Now, I didn't put it on here, but I'm going to talk a little bit about how this would affect her in college. So something that I would like to mention for an accommodation at the college level, not only giving her extended time with her professors as far as in-class discussions, classwork, homework, quizzes, tests, but also a big one is prioritized scheduling. That gives her the opportunity to build her class load prior to sophomores, juniors, seniors. That also benefits her in the fact that if she's not a morning person, or she wakes up every morning and she is vomiting, she definitely doesn't want an 8:30 a.m. class Monday, Wednesday, and Fridays. So that prioritized scheduling helps with that. Another one that we actually were talking about before the discussion was maybe having a private room, making sure that the room is air conditioned. There are all different accommodations that can be built in at the college level. The key point is that you set up an appointment with Disabilities prior to your student attending that college. Are there any questions? I know I kind of breezed through that quickly.
Why do teachers not want them to have a plan? Is it more paperwork, or is it?
With the 504 plan, it's not even about more paperwork. Again, it's a pretty simple, fluid document. I think it's more just about they're uneducated about the medical aspect of that student's needs, and they think that they're supporting them just fine the way it is, the way they are in the classroom every day, but there are going to be times where they need more specific accommodations. And again, it's just about protecting your student, and it is the law, so they should be following it. But yeah, I think just teachers in general, it's not about, the paperwork itself. I think it's just they think Johnny or Susie's got good grades and they look good on the outside. They don't really know what's going on inside, and they feel like they can support them just by, as accommodations come up or as needed, they'll just support them. But really, truly, you should be pushing for the 504 plan to be in place. Yes?
Do you know if there is a break? If my daughter wanted to go back to college now that she's recuperated for the most part, she had to drop out of college because of the injury and the Chiari and the surgeries, but she was like a year short on her degree. So if she wanted to go back and there was a big break, could she still take advantage of that?
Absolutely.
Okay.
It doesn't end at the college level, and it doesn't matter what age you are. I think I would recommend that she still get a letter from her medical team, just talking about some of the side effects that she still continues to have, presenting that with disability services, and they will accommodate her. Yes.
So, is it okay? I was going to ask you on a very basic level, so your suggestion is start with her medical team
Absolutely.
and say that you would like them to write a letter for 5.
Yes, definitely. And I know in your daughter's situation, because she comes from a private school, they don't necessarily have the 504 plan in place, but I've had patients before come from a private setting, and they are still accommodated at the college level. And it all is based on the medical team's letter from the physician stating kind of a breakdown. I'll be honest, I help create the letter, and then the doctor will look it over and make sure, just because I know what to ask for as far as certain accommodations, like, sorry, Dr. Kellogg, but I don't think he'd know to ask for prioritized scheduling for some of our patients. So that's kind of where the collaborative team approach comes in. Yes?
The homebound, that's something that the school then has to provide?
Yes, absolutely. Yes, it's the law. So if they miss 10 days or more, if they're consecutive after the 10th day, yes, the district has to start setting up basically the paperwork and looking for a tutor within the district. Sometimes they're substitutes. Sometimes they're actually teachers of one of your children's teachers. Could be their 3rd grade teacher. And it's 5 hours a week maximum.
Is that whether you're on an IEP or a 504?
Yes. Yeah, and some kids don't even have an IEP or 504. They might have just had surgery and maybe due to a car accident, and they're on homebound for, say, 6 weeks, immobile. So no, they don't necessarily have to have an IEP or 504 to receive homebound services.
Oh, interesting.
Okay? Thank you.